Good evening, everyone. Imagine you're in the western part of Nigeria, in Lagos to be specific, a very populous city in the country. Now imagine it's the rainy season, and now it's the rainy season, it's really humid. And also imagine that people are beginning to cough and you have the elderly getting sick. You also have the young ones who are becoming really weak. Now imagine that you're the medical practitioner who is tasked to responding to an outbreak of an infectious disease in this area. What would you do? Mind you, the resources that we have are limited. Would you take the limited resources to Lagos, which is a populous area to start with? Or would you take it to the rural areas or the villages around? Where would you begin? Every hour seems like something that is really important because here you have a major decision to make. Now, imagine if you could predict where next the disease could go to. Imagine if you could predict who could be infected and who is susceptible to getting infected. How much power would that be? My name is Michael Kama, and my research is about agent-based modeling technique system. Now, with an agent-based modeling technique, which is ABM for short, we use agents in a computer simulation. And in this computer simulation, we are able to simulate the interactions between people who are both infected, people who are not infected, people who are infected and are showing symptoms, people who are also infected and are not showing symptoms, and people who are recovering from these infectious diseases. By simulating these scenarios together, we are able to extract data that ordinarily we would not have extracted. Now, at the down right of the screen, we can see a simulation of 100 families and how they interact in the work environment. What happens when these people interact with each other? How rapid is the infection? Now, with this, you realize that this is very important, and you might ask, okay, why is this really important? Two major reasons. Number one, it means that we are proactive. Now, healthcare decision makers don't have to wait for another COVID-19 before they are able to get the data and also start scrambling on how to prevent the spread. But we can create what-if scenarios, and with these what-if scenarios, we're able to prevent such a large scale and also positively affect the lives of hundreds of millions of people, if not billions. Secondly, it is sustainable. The software I use for this is free, though there is a paid version, but I use the free version. And with the free version, governments with limited resources can help to impact the lives of people. Now, you might ask me, why is this so important? Well, this is so important because, coming from Nigeria, out of the top 10 causes of death in Nigeria, 5 of them happen to be infectious diseases. And this is not just the story or case for Nigeria alone. This is the case for a lot of tropical areas around the world. And now, this is not just saving the lives of Nigerians, but of billions of people around the world. Ladies and gentlemen, here is ABM, the future of policy making and public health. My name is Michael Kama. Thank you.